There are a number of social factors to do with the local area and to do with how the disease gets reported that will affect how the model results appear and how they compare with actual data. The first of these concerns the normal contact rate that happens between people in the population. If the region you're looking at is very densely populated, it's a very dense city for example, then that normal contact rate will be very high. If it's a much more rural distributed geographic area, then that contact rate may be much lower. Now that number concerns contact rates when people are healthy, and if people continue with the disease with no symptoms or very, very mild symptoms, they will likely just carry on with that normal contact rate unless they reduce that rate, either because people generally are being more careful or because of enforced social distancing. The next number concerns the normal contact rate when people are actually ill enough to stay off work or to stay off school. Under those circumstances, they would reduce their normal contact rate anyway. A further factor to do with the number of cases that end up getting identified and reported concerns the number of severe cases that don't go to hospital. This tends to be focused on care home settings, but there could be other reasons why people, even with severe symptoms, choose to stay at home rather than go to hospital. Unfortunately, their chances of survival are rather less if they stay at home than if they are hospitalised. The three items to the right concern the confirmation reporting of actual cases. The top one is the percentage of mild cases that get confirmed and reported. As you might expect, this is a really rather low number. In fact, we've estimated at 0 for the period that we've looked at in London. People simply don't bother or can't get themselves confirmed as actually having COVID-19 when they've only got very mild symptoms, and those numbers clearly don't get reported anywhere. The next number concerns the percentage of cases that are severe but relate to people who are at home or in care homes, and that's a more significant number, but again the percentage that do not get confirmed and reported don't feature in the numbers of cases that get talked about in the media. The last of those three items concerns the number of severe cases that actually die at home or in care homes, and even those don't all get confirmed and reported as being due to COVID-19. Now you can change any of those numbers, they are all just simple values. You click on any one of them and just change its number in the formula to the right. The last item in this section concerns changes that take place over time to the fraction of people with severe symptoms who end up dying. Now, there are a number of reasons why that number may gradually decrease. First of all, the medical profession itself, the health service, may get much better at keeping people alive who've got severe symptoms. They learn from the cases they've treated and improve their treatment. And then there could be environmental factors as well, changes in the weather and so on. Lastly, there is the hope of increasingly effective treatments for people who are suffering from severe symptoms of the disease. We know this is happening, so you could expect over time that for that reason too, the fractional death rate for people with severe symptoms will gradually decline. And the way you use this is simply sketch in the reduction in death rate that you expect to arise from any of those causes.